अस्सलाम वालेकुम इय्याका नअब्दु व इय्याका नस्तईन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज की इस वीडियो में गायनी का मैं पोर्शन स्टार्ट करने जा रहा हूँ। सो लेट्स स्टार्ट विद द गायनी 22 नवंबर मॉर्निंग पेपर। द पोटेंट कार्सिनोजन फॉर द कैंसर ऑफ द सर्विक्स इज HPV। द वर्कर इज बीइंग working near the nickel metal shop which carcinoma is being predisposed likely, that is the nasal. Burkitt's lymphoma translocation is which of these, that is the 8:14. 9-year-old girl has high grade fever, has the papules rash starting from the behind the ear and spread to whole body. Most likely diagnosis would be the measles. Next, the patient has the fever, neck pain, and the rash organism responsible for the meningitis is the Neisseria meningitis. The patient presented the abdominal pain and the pelvic pain upon taking history. IUCD was implanted. Causative organism would be the actinomycetes. The person with the difficulty in the swelling, there was some white growth inside the esophagus with pseudohyphae. Likely cause would be the candidiasis, which bacteria has no cell wall, that is the mycoplasma. Immune system produces memory, to which the component of the bacteria, that is the carbohydrate composition, the bacterial cell wall. The British woman went to Thailand, presented with the fever, Riger cells. Most likely she is suffering from the malaria. Next, the person went to Thailand and the return presented the diarrhea, which is watery in large amounts. Stool showed the donut-shaped crystal, that is the cryptosporidiosis. Which of the following spread by eating raw and the uncooked meat, that is the tapeworm. The antisera agglutinates with the A and D, and the plasma has NTB antibody. Which blood group it is, that is the A positive. Next, question number 14. The patient with the late puberty had the small intestine, large legs, and the gynecomastia, and the karyotype is 47XXY. With most suitable diagnosis would be the Klinefelter syndrome. Mentally retarded 14-year-old boy has a microcephalic and the low ear epicanthal folds and protuberance of the tongue. Chromosome analysis is likely to demonstrate which of the following, that is the trisomy 21. The early adolescent with the prominent forehead, everted looking ears, and long longitudinal mandible, long testes, and hypogonadism is clinical diagnosis of the Fragile X syndrome. AST is raised in the pancreatitis. The patient with alcoholic hepatitis with the Mallory bodies. Interwoven structure is the intermediate filament, the formation of which is necessary for the transition from the G1 phase to the next phase, that is the DNA. Feature of the well-differentiated squamous cell carcinoma is the keratin pulse. The medullary carcinoma CA tumor marker is the calcitonin. The thyroid hormones bind with the thyroid binding globulin. Almost all of the active thyroid hormone released in the calcitonin is the thyroxine. The characteristic of CYAT is hyperosmolar urine. Next, the patient has the complaint of the polyuria, but the blood glucose level in ADH are normal. The cause would be the nephrogenic diabetic insipidus. The insulin release is increased by the secretin. Next, the minimal requirement for the expression of the phenotype in the tumor syndrome would be the complete monosomy of the X chromosome. The patient at the 20-week gestation passing clots and the vesicles, which finding will be present, that is the increased beta HCG. Ovarian cancer first metastasized to the para-aortic lymph node. The upper lateral lymphatic drainage of the breast include which of the following, that is the anterior pectoral. The vulva nerve supply is the pudendal nerve. The person fell from the height, now has urine incontinence with spinal root, will be checked, that is S2 S3 S4. The rectum and the anal canal receive parasympathetic supply from the S2 S4. The person got stabbed in the upper arm. The floor of axilla, which of the following structure will be damaged, that is the intercostobranchial artery. The subacromial space ends at the S2 level. Next, which of the following structure pass through the foramen ovale, that is the accessory meningeal. The regarding pituitary gland relation true with the cavernous sinus laterally. The pars distalis is supplied with the superior hypophageal artery. The 39. The pigment in the substantia nigra is the neuromelanin. The during exercising muscle blood vessel dilation occurs via the local metabolite. The athletes have the enlarged heart size comparatively the increased stroke volume. Instead, their muscles need the same amount of energy, and the having cardiac output approximately same as there is normal individuals. Which can be seen for this, which can be the reason for this phenomena, that is the decreased heart rate and increase SV. The end of marathon race, a person has a high glucagon and the low insulin. Man waiting for the bus from 60 minutes in the moderate hot environment. How body will regulate the temperature, that is the cutaneous hyperemia. The patient was operated for the small tumor blocking the cerebral aqueduct. After a few days, the presented the disturbance of the sleep. Which nucleus is damaged, that is the suprachiasmatic nucleus is damaged. The Philadelphia chromosome is associated with the CML. The patient developed the cirrhosis few years after abdominal surgery. Keeping in view viral etiology, what is the feature? That is enveloped single stranded RNA virus with reverse transcriptase. Sertoli cells release which one? That is the androgen binding proteins. The parasympathetic action is the constriction of the airway. The peripheral neuropathy secondary to the isoniazid is reversed or prevented by the B6. The patient is having the bleeding problem. Lab shows the PT of 14 second, APTT 60 second. The bleeding time 66 minutes. And the effect in which of the following pathway? That is intrinsic pathway. The patient undergoes gastrectomy with the peripheral paresthesia MCV 112, macrocytic anemia. Treatment must be injectable vitamin B12. The patient has the anemia, raised MCV, again peripheral numbness, that is definitely megaloblastic anemia. The 53 child has the history of the pica, now has the pallor, fatigue, and low HB. The suitable diagnosis would be iron deficiency anemia. Cyanide poisoning will affect which complex electron transport chain? That is the complex 4. Next, question number 55. The retropharyngeal lymph nodes drain into the pharynx. The hymen epithelium is lined by the stratified squamous. The ovary surface epithelium is lined by the simple cuboidal stratified squamous non-keratinized epithelium, abundant vessels, and the elastic lamina propria with no glands. The tissue would be the vagina. In last trimester of pregnancy, what change in the respiratory parameters occur? Decrease FEV into FVC. The source of estrogen progesterone in the last trimester is the placenta. The progesterone malfunction would be the secretory phase of endometrium. The perfection of the mammary ducts and the fat deposition. The breast is primarily by the estrogen. The acute phase of stress, which hormone will raise? The cortisol. The biopsy of specimen CA showing the fibrovascular septum and the scatter calcifications giving like sand like grain appearance. Which tissue is most likely? That is the breast tissue. The lymphocytes normal percentage would be T lymphocytes 80 to 90%. 66. The medial wall of the ischiorrectal fossa is formed by the levator ani. Next, the main support of the pelvic viscera with the levator ani. The median episiotomy. The perineal body is damaged. The perineal body cut. Which muscle is damaged? That is the bulbospongiosis. Which structure forms the pelvic diaphragm? That is the pubococcygeal. Which structure is formed from the genital tubercle in the female? The clitoris. The female with dragging sensation, the lower abdominal examination, cervix, the introitus ligament is damaged. The uterosacral ligament. The multigravida female with the third degree prolapse. Which ligament will be damaged? The uterosacral ligament. Next, the 29-year-old woman is admitted to the hospital because of the birth because birth of her child is several days overdue. Tearing of the pelvic diaphragm in the childbirth leads to the paralysis of which of the following muscles? That is levator ani. The data on two group of diabetic collected. Look at the male and the female pattern of diabetics had a mean random blood glucose level 200 and the males have the mean RBS level of 205 plus. The result reveals that the women have the lower median and the higher SD in this group. The test which excludes the completely non-affected person would be the specificity test, which excludes completely non-affected person is the specificity. Standard deviation measure is the variability among the individual values. The regarding prevalence true is all cases. There is no option of old and new. The result of positive test came positive and negative came negative. This is related to the accuracy. Next, the surgeon treated 200 patients of the hemorrhoids. He randomly divides the patient surgically treated in the pharmacologically treated groups. After 1 year, he assessed the patient and find that the surgically treated patient has the better outcome. Type of the study, that is the randomized control type. Which one of the following inorganic compound is carcinogenic? That is the asbestos. A group of the mice was taken. Injection of the plastic hydrocarbon was given. This will work as initiator in the process. The initiator work as the memory produce. Informed consent is important because it provides the participant with all information regarding risks, benefits, and alternatives. Next, the pregnant with the blood sugar 300 came to hospital. What should be given? That is insulin. Next, 85. Which of the following the posterior vein of sacroplexus, the common peroneal nerve, most medial branch of the external carotid artery, the ascending pharyngeal? The patient undergo laparotomy for the tubal ligation. Post-operative, her abdomen was reopened due to the slippage of ligature and the hemorrhage bleeding, most probably from which artery? That is the uterine artery. 33-year-old obese woman had the hysterectomy, lower segment fenestrol insulin was given. There was serosanguinous discharge after 3 days. What is the likely cause? That is the wound dehiscence. Emboli in the venous circulation will lodge in the lungs. The atherosclerotic plaque is caused by the endothelial injury. The female with the signs and symptoms of hyperprolactinemia was diagnosed the pituitary atroma. The growth of this tumor anteriorly will compress which structure? That is optic nerve. The patient has the venous symptoms and amenorrhea. She is diagnosed as a case of hyperprolactinomas. She has bitemporal amenopia, which lesion that is the region of the optic chiasma. The tickle sensation is carried by which fibers? That is the C fibers. The nitroglycerin mediates its vasodilator action through the it is cyclic GMP. Next, a patient loss of proprioception occurs after RTA, which is underlying mechanism. That is the lateral inhibition. The which drug is used in the headache and the contraindicated in the peripheral vascular disease? The egometry. In the old female fell in the washroom with the fracture replaced by the process. Even following this, she developed the dyspnea and the petechiae on the wrist skin. The cause is which of the following? The fatty embolism. The patient presenting the shock-like condition after RTA. Multiple soft tissue injuries. Cause of shock in this condition would be the peripheral vasodilation. Next, the neutropenic hypertensive patient is in the oncology ward. The history of this high-grade fever. The blood culture yearly growth of the Pseudomonas aeruginosa. The findings suggest the disease is a result of the excessive release of which of the following: there is the TNF. The Pseudomonas colitis is caused by the Clostridium difficile. The diabetic patient, the peripheral neuropathy, which structure prevent attack of the toxic material in the structure damage in this patient with the endothelial cells. The diabetic hypertension patient having the myxedema present with the BP of 200/100. Which drug should be given? That is the captopril. The patient brought to the ER unconscious. There is a breathing problem. Empty bottle of the aspirin found low sodium bicarbonate will increase tubular excretion of the aspirin. Next, the leucovorin is used to prevent the side effects of the methotrexate. Which drug has the action similar to the atropine? There is the scopolamine. The patient is the lower back and the pain reduces the thigh in the leg. Show the disc herniation. The L4 L5 is nerve root is compressed. That is the L5. Bone density is best assessed by the DXA scan. The man having joint pain, the renal stones with high level of the calcium, high PTH, normal PTH, low phosphate. This is related to which of the following condition? The primary hyperparathyroidism. EDB depends upon the venous return. The venous return is increase in the inspiration. The posterolateral infarct artery involved will be the left circumflex. The end systolic volume is 50 and the stroke volume is 70. What is the end diastolic volume? That is the 120. The gold standard investigation for the placenta previa is the transvaginal ultrasound. The uterine artery pulsality can be detected through the Doppler ultrasound earlier at the 7th week. So the following is a pain mediator after knife injury, that is the prostaglandin. Next, the interventricular septal thickness, septum to free wall thickness 3:1. What is the cause? Hypertrophic cardiomyopathy. Aldosterone acts mainly upon the distal tubules. The patient is dehydrated or osmolality increase. What will happen? That is the inhibit volume and osmoreceptors and the stimulates ADH secretions. The right shift to the oxygen dissociation curve, decrease participation of oxygen. The patient has a carbon side of 54, pH of 7.3 and the bicarbonate 24, normal in and gap. What hypopacity based balance is this? That is the partially compensatory respiratory acidosis. The player hiked to mountain, reached 12,000 feet height and the further moving 2,000 feet. He was having low participation of oxygen, developed dyspnea. The likely etiology is the hypoxia. The patient with the HB of 15, oxygen content of hemoglobin is 20, alveolar participation of oxygen 40, the venous oxygen 15. Which type of hypoxia is this? That is the hypoxia child with the hepatosplenomegaly. Streaks on hair and the face, abdomen. Protruded cause is the kwashiorkor. The pregnant lady with the develops some skin changes just like her uncle who is receiving positive cirrhosis. Which are those changes? The spider telangiectasia and the palmarrhythmia. There is a variation in the incidence of preeclampsia. Most significant changes in the fall of this is due to the unanimous definition of the disease. Next, which one is directly related to the coronary artery disease? There is a LTL seal. The bone remodeling is done with the osteoblast in the class. Which hormone converts to its active form by the 5-alpha reductase in the peripheral tissue? Which is the testosterone neurotransmitter of the mood is the serotonin, and there has been the low dose in which of the following: that is in thromboxane. To which of the acid first specialized in the TB is the mycolic acid. The cells present the damage and tissue after cerebrovascular accident. The glial cells in the first step in the CSF formation by the choroid plexus is the active sodium secretion. The ultrafiltration man uncovered lying in the room at 28 temperature. Heat loss is by the radiations. The typical spinal nerve is the mixed nerve. The MSC function is the immune recognition. Next, the polyarthritis nodosa diagnosis is by the fibroid necrosis. The easiest way to make the clearance of the drug is the plasma half-life. The person is infected with the staph aureus. What is the role of lymphatics in the immune response? That is the return of the blood back in the circulation. The patient has the muscle tetanic contraction on the first post-op day of the thyroidectomy. This is due to the hypocalcemic tetany. With rapidly repeated stimulus to a skeletal muscle activation of contractile mechanism occur immediately before and dissection has occurred. Continuous contraction without relaxation, individual response run into one another. Such a response is called the tetanic contractions. Next, 142. The middle age known end-stage renal disease. List for the hemodialysis, multiple transfusion done, normocytic, normochromic anemia. What is the most appropriate therapy? There is a subcut erythropoietin. The girl came with the increased fatigability, with the increased pigmentation on all body and the splenomegaly, having HP of 8.1, MCV 58, MCSE 30, the fat in 2000. What is the suitable management? There is the deferexamine. The phrenicoelic ligament damage. It spots which structure, that is the spleen area for the mitral valve. Auscultation is which of the following: the mid-clavicle line of the left fifth intercostal space. The common cause of the non-obstetrical death in our country is the heart disease. Next, 147. The patient undergoing workup for the primary infertility. Most liable indicator for evolution would be the thick cervical mucus with no fun. The hereditary is parasitosis. Defective protein is the spectrin. The von Gerke disease. Enzyme deficient with the glucose phosphatase. The singer's vocalis related to which of the following? That is the thyroid retina. The woman with the 5 weeks of pregnancy German measles. He consulted her obstetrician worrying about the baby. Which is the most likely complication the baby might develop? That is the congenital cataract. Next, 152. The patient from the hill station having the labor pain, ECG done, fetus normal, still which normally which normally can be at the greater risk, that is the PTA. The umbilical artery carries the deoxygenated blood to the placenta. Like the structure passing around the arch of aorta, ligamentum arteriosum is the left recurrent nerve. Microtia is due to the defect of the first and second branchial arch. The atrioventricular dissociation occurs in the third degree. Complete heart block. Nucleus pulposus is derived from which of the following? That is the notochord. Next. The 45-year-old diabetic lady since 10 years admitted in the hospital with the pneumonia and developing shock-like symptoms. Cause will be increased vascular permeability. After RT, a massive blood loss, patient undergoes a shock, BP 85 by 40. What will activate now? That is in a systemic source. The Brunner's gland is present in the duodenum, SMA, IMA, and anastomose. As which of these? There is a marginal artery. The following produced by the plasma cells. The gamma globulin, the increased ESR is due to the decrease in the albumin. 160 for the lady with the pallor and the weakness and examination will MCV. Taste changes in the next in the stool. Diagnosis will be the ankylostoma. The mechanism of the reduction of size of organ in which in the patient undergoing chemotherapy of the breast apoptosis, the girl with the cyclic lower abdominal pain every month with amenorrhea, P exam normal, Hyman ring normal. Cause would be the cervical atresias. The mechanism of action of the local anesthetics would be the blocked sodium channels. Next, the remnant of the gubernaculum in the female includes the ovarian ligament. Next, 169, the least dilatable part of the urethra is the membranous part. The which of the following drug causes the tachycardia at the normal dose? There is a pathogen in the breast of adult female lies over the superior pectoral fascia, which hormone stores carbohydrate, protein, and the fats. That is the insulin. 173, the right bronchial artery arise from the thoracic aorta at the right third posterior intercostal space. The nystagmus is caused by the lesion of the nodular lobule of the cerebrum. The deep inguinal ring is formed by which of the following fascia transversalis? The child with the generalized body edema. The cause is the hypoproteinemia. The thirst is increased by the increased angiotensin 2. Next 178, the old man was being treated with the GP for the infection with the certain drugs came to you with the complaint of the generalized weakness, pallor, easy bruising. HP5 decrease the RBC, TLC, and the platelets reticone 0.1. The bone tap hypocellular bone marrow which view cells. The diagnosis of plastic anemia. The pregnant lady came with a premature rupture of the membrane. She suspected of the chorioamnitis. To confirm intra-amniotic infection, what test should be done? That is definitely interleukin 6. The halothane is given as a general anesthesia and the poor analgesia, which should be added for the battle analgesia. That is the nitric oxide. The adrenaline causes vasodilation through which receptor beta 2 adrenergic action potential from the cell to cell is by the gap junctions. Next, the pregnancy iron deficiency anemia is best diagnosed by the serum ferritin. The 184, the immediate action of the insulin is the potassium entry into the cells. Next, last, the feature common in the simple and the facilitated diffusion of the glucose is occurs down an electrochemical gradient. So thanks for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.